everyone, in this video I am going to explain about Bing test. In this video I am going to explain how the Bing test is performed. So let's instruct the patient. I will stack the tune fork and I will place it on the master bone, and at the same time I will close and open your ear canal, and you inform me when you hear the louder sound. When did you hear the louder sound? While opening or closing? Closing. So this test is normal. Now let us look into the Bing test in detail. Bing test, proposed by Albert Bing, principle. This test is purely based on the principle of occlusion effect. Procedure: stack the tuning fork and place it on the mouth-to-mouth process of the patient without occluding ear canal. After few seconds, close the patient's ear by occluding, pressing the tragus. The patient has to say whether he perceived the tune louder in occluded or non-occluded condition. Interpretation: Being positive, tune perceived louder when the ear is occluded, which indicates normal hearing or sensory neural hearing loss. Being negative, no difference in perception of the tune in both conditions, which indicates conductive hearing loss or mixed hearing loss. Due to the presence of conductive hearing loss, there is already an occlusion effect is created. Hence, by closing the ear canal does not make any difference in perception of the sound. Advantages: easy to administer, easy to identify conductive pathology. Disadvantages: purely based on patient's judgment, hence chances of having false results. Cannot differentiate between conductive hearing loss and mixed hearing loss. Results may depend on the frequency of tuning fork used. Audiometric Bing test. This test uses a bone vibrator for the testing insert of a tuning fork. Audiometric Bing test helps to reveal the size of the occlusion effect across frequencies: 250 Hz, 500 Hz and 1000 Hz. The size of occlusion effect is important to measure the amount of noise to be given during masking. Interpretation: audiometric being positive if the occluded thresholds are significantly better than unoccluded thresholds, which means that there is no conductive pathology. This would occur in case of normal hearing or sensory neural hearing loss. Audiometric being negative if the occluded and unoccluded thresholds are essentially same, indicating that occlusion effect is absent. This suggests that there is a problem with the conductive mechanism, which implies that the hearing loss is conductive or mixed.